So if the outbreak happens in Richmond or York region,
Yes.
do the hospitals in York region are ready to take this kind of challenge and then the special measures?
Definitely. So before SARS, or during the early phases of SARS, we didn't have adequate equipment even, right, in many of our hospitals, the ICU rooms, with the respirators, etc., But today we've come a long way in that the healthcare system is much better prepared to be able to deal with that. That having been said, I am not at all saying that we're going to get there, right? At this point in time, we're not seeing any cases in York region, right? So it is very safe in York region, and we are nowhere near that particular instance. During the SARS time, we already had a number of people infected in the hospitals, and you were seeing a number of healthcare workers being infected, etc. But today, we take a lot of precautions. Our infection control practices have come a long way, and I don't see anything like SARS getting repeated here, right? So really, I think the public needs to be reassured that we don't have the virus circulating just now. If things were to get worse, we will be on top of it, right?
So every day, thousands of cases confirmed in China,
Yes.
right? But here, it seems that to the public that it takes many days to confirm one case. Is that the testing method be different from Canada and in China?
Actually, that is testament to the fact that there isn't any coronavirus in Canada, right?
Okay.
You see, if we had cases of coronavirus, our labs are the best in the world, and they would be able to detect that very quickly. In fact, even our Ontario lab is excellent, right? So whilst we await confirmation from the Winnipeg lab, our Ontario lab is excellent. It's world class, right? So really, it's testament to the fact that there is no coronavirus here, right? So in China, you have a problem. And one of the accounts that I was reading about China was that when they first started defining what is a case, they had required a test to be positive as well. And that meant that, unfortunately, many people were probably being missed, right? So that's one account I've read of a physician from China, right? But here, the tests are excellent, and we don't see any positive results as yet, right? I mean, we see those that you're already aware of, right, which are linked to China.
Doctor, may I ask, as you said, there are not a lot of cases in Canada, and so does maybe US or Australia, but some countries decided to close the borders on China travelers, and as Canada, we're not doing that. Do you think that's fine? We don't need that.
So according to the many of the studies that we have seen, they basically talk about the screening at the airports, right? Which really isn't very useful at preventing, the infections from coming into a given country. We believe that the World Health Organization has taken the stand that you shouldn't be closing your borders, right? So we are, as I explained to you, we have a system in terms of the public health system, and we are working with the World Health Organization through our public health agency in Canada, and there are no plans at this point, as far as I'm aware, of closing our borders to anyone. And we hope that the visitors that come here from China will continue to monitor themselves for 14 days for signs and symptoms, and the host families will reinforce to them the necessity to do that. And if they happen to come from Hubei, then they are to be self-isolated along the lines of what is on our webpage, right? And we hope that the host families will help with that message in order to keep our communities safe.